have. So I somewhat alluded to it from the table of contents. So anyone have any guesses? What function does the eye have? Okay, we'll move on from that. You know, it detects light and then it converts it because the brain is also involved through the optic nerve of the eye. Okay, what are some parts of the eye that we know of? So there's about, what, 5 of you guys in here? So if you could all drop one part of the eye and type it in the chat. So pupil, iris, retina, cornea. Yep, we're just missing on one person. Yep, you guys are all correct. We're just missing on Angela. If you could just drop part of the eye. Okay, I don't think she's responding, so. Yep, so I've written down lens, retina, pupil, cornea, and there's so many more. So eye anatomy, right? So there's 3 chambers within the eye. So we have the anterior chamber, which is the front part of the eye between the cornea and the iris. So this right here, right, if we look at this, you know, here was, this is like the, in quotation marks, the pupil. And then behind that, we would have this entire thing right here. Can you see how it's kind of clearish? That would be the cornea. And then behind the cornea, as you see right here, I think it kind of looks like an odd shape. This is not how it looks in our own eye. But that would be the iris. So you know the colored part of our eye. So then the posterior chamber would be between the iris and the lens. So the lens would be somewhere like right here. Unfortunately, they don't show the lens here. And then the vitreous chamber would be between the lens and the back of the eye. So you'll understand why they call it the vitreous chamber later on. Okay, so here I'm going to talk about a bunch of the different parts of the eye. And just a disclaimer, all these pictures are from a sheep's eye because sheep, you know, those are the go-to for dissections. I personally dissected a bunch of sheep's eyes. I wish I had like my own pictures of the eye I cut up because I feel like I would have taken more time into like, you know, making them look nice. But what I found was fine as well. So first we have the cornea, right? So it's this, here we can see like all the kind of like fat that protects the eye. I know when I was dissecting, like there would be a lot of fat surrounding the eye. So I'd have to like cut that out first before I even cut the eye open. And you know, this right here, I would like a lot of times compare it to like a windshield, because like a windshield of a car, because you know, if it's raining outside, the windshield is protecting you from the rain, right? So the cornea protects things from getting inside your eye. You know, you don't want dust in your eye or eyelashes really entering inside your eye. So next, we have the iris. So this is obviously the colored part of the eye. On this side, we actually don't see the colored part. This is the other side of it. So we have like the colored part on one side and then we have black on the opposite. And it contains very fine muscles to control the size of the pupil. Yeah, so the iris, I don't really have a comparison to it, because I mean, I guess a fun fact is people with blue eyes, they don't have blue pigment. I'm sure you guys may have known that before. Blue pigment is not found in nature. Um, the only way we really see blue um, kind of pigment is like with the blue morpho butterfly, but that's because of the reflection of light against the little like I don't know how to describe it. The little um, on its wings. If you were to zoom it up on a microscope or something, you would see a bunch of little shapes, kind of like scales. So the light reflection against that creates the blue kind of image and look of the butterfly. So blue people don't have blue eyes. They actually have brown pigment, but they have fairly less brown pigment. So the difference between me and a blue-eyed person is that I just have a lot more brown pigment in my eyes. So there's brown pigment and then there's yellow pigment. Yeah, so those two pigments, whether they're solo, the amounts, or they mix together, determines eye color. So then we have the pupil. So it's a dark center opening that controls the amount of light reaching the retina. So there's, unfortunately, because this is not like a real life dissection, there's a lot of things I cannot do. But if we were to look at an eye before, right, if I just can go to my last slide. Oops, right? Here's the pupil, right? We see it as black. But then if we look at the pictures here, there's no pupil. Like there's no little black circle that we see. And that's because the pupil is actually a hole itself. The pupil is what we can call like a perfect, I don't know I forgot the actual word, it's been a while. But it's this like perfect, almost like a black hole, because light is coming in, right? Because light travels from the environment to inside our eye, to the back of our eye. So light's coming inside, so it goes through the pupil, but light's not coming out. So the reason why we see pupil as dark is because there's no light coming out. So it's only going one way. So when we take everything apart, there's no pupil because there's light on both sides. Okay, so next I'll go to the lens. So the lens is kind of like a little ball, kind of sort of really small, and it helps focus light onto the retina, right? Because if we think of lens like glasses, camera lens, a microscope lens, they all help focus light. And for any of these structures, right, in our own eye, they would be completely clear, they would be transparent, because that would be the optimal way for light to travel through. Here, through all the stuff they set the eye in, kind of changes colors, this would be completely see-through. It wouldn't have this kind of like weird colorful color, it would just be see-through, because it already goes through this process of having light pass through it. We want the best optimal measures for it to go through. So yeah, the lens, it just helps focus light. And then, if you see here, right, we see these little black things, and that's because the iris, they're like, there's part of the iris that's with it, because when it's in the eye, it's part of it attaches, because they're all dependent against each other. So next we have the vitreous humor. So it's a clear gel that fills the eye, and it really gives the eye its shape, right? So the eye is circular. So this is kind of like the stuffing in a teddy bear. if we take out the stuffing from a teddy bear, it's not really a teddy bear anymore. It doesn't hold upright, so we need the stuffing to be there because it helps give shape. Yeah, so the vitreous humor, I'm not sure how to really describe it more than just saying it's kind of like jello. It's really, it can move a lot, it jiggles a lot. So it's very like, it can easily change its form because if you were to take it out of the eye, apart from like the eye itself, like the, all the structures with the eye on the outside, obviously that also helps give it shape. So the vitreous humor also kind of just helps keeps things in place. So then we have the retina, and as this is the retina right here, and it contains light-sensitive photoreceptor cells, right? Because if you look right here, this is where the optic nerve would be, right? And the optic nerve leads to the brain, so then our brain can process what we're seeing, basically. And the retina is really delicate. I mean, like so delicate, like nylon tights. And if you guys ever worn tights, like you know how easy it can be to like rip them. So I would definitely say the retina is definitely like that. I had many occasions trying to like take the retina out in one piece. And it gets difficult sometimes because there's also this part right here. Oh, I forgot the name. But this is something that we don't have in our own eye. So in the back of our eye, we have, blood vessels. So when we take pictures, that's why we end up with red eye in pictures because we have those blood vessels. But when we take pictures of our pets or animals, they have like white eyes because of this part back there. Yep, so all animals, okay, I wouldn't say all animals, but a lot of animals have it. And this helps them with night vision. So if I could just, I think it's tapetum lucidum. I think that's what it's called. Yeah, tapetum lucidum. Yeah. So the tapetum lucidum is this very colorful structure. It's covered back here. But yeah, it helps gives them night vision. So we don't have this, so obviously we cannot see in the dark. So how light travels. So light passes through the front of the eye, the cornea right here, through the pupil, which is the hole, and into the lens. So now the cornea and the lens help focus the light rays onto the retina. And the light also passes through the vitreous humor, so that clear gelatin, jelly-like substance. And at this point, right, this is like the connection to the optic nerve. So here's where the retina absorbs and converts the light to then have it go along the optic nerve in the brain. So overall, it just passes right through. Obviously, it depends on the angle, which is why, the lens and the pupil adjusts. Overall, it's in and through. Okay, so certain eye conditions. So before I start talking about them, do we happen to know any of these eye conditions? Any guesses are fine. Okay, so Camilla said pink eye, someone said astigmatism, blindness, cataracts, dry eye syndrome. So those are all things that are some have to do with the eyes, but there's a difference between eye conditions and then eye diseases, right? So conditions doesn't mean you're sick, you know, but disease on the other hand means that there's something, I guess it's hard to differentiate, um, but like, so sorry if I say your name wrong, Juira. She said astigmatism, right? So that's an eye condition. You know, it's not something we can change it. We can try to fix it, but it's not like kind of impeding on their health severely. Oh, so Yashaswi, I'm so sorry for saying your name wrong. She said um, lazy eye. I don't know how to say that word very well. But yeah, so that's our first one. I was talking about the lazy eye. So it's on the previous slide. You know, when um, kind of like one of the eyes is kind of looking in a different direction or like in a diagonal direction. So this happens because if we look at the symptoms, right, there's poor vision in one or both eyes. So a lot of people who have lazy eye have poor sight, so they wear glasses or contacts. They might have frequent straining, or they have to close an eye to see. I remember doing that when I was younger, before I had glasses. Um, Also getting eye strain and like some headaches. And the symptoms, the causes, um, I guess it can't really be pinpointed. It's just something abnormal that happens. But it typically occurs like when you're children. Um, so what happens is that like, you know, as if we look at the pathways, right, through the eye to the brain. So this kind of occurs with the brain where these connections are not made between both of the eyes equally. So then when there's more connections made with one side of the eye more, you know, the brain's gonna obviously go to that eye, you know, that eye's gonna get those, um, it's kind of like favoritism. It's weird to say because, you know, technically the brain does not have that capacity to necessarily like the structure itself favor one thing against the other, but it's the fact that like it was a lack of enough neural connections with one of the eyes. There's like that imbalance that allowed one eye to not have that chance to really make those connections any further. So it leads to one of the eyes to just kind of go astray. So some of the treatments is that they can administer atropine to the stronger eye, so then the vision goes blurry, and then now the person can use their weaker eye and, you know, begin, you know, kind of rewire those connections again. And they can also use an eye patch for the stronger eye, just so they can just stop using that eye overall, for the time being until, you know, symptoms and their condition gets better. Okay, so next I have cataracts. So cataracts, as you guys have seen, is like that cloudy vision. Right, so some of the symptoms are cloudy vision, they can't really see at night, they're sensitive to the light, they may get double vision, and they may even see colors as like duller, having it be more dull. And cataracts often occur to people of old age. You know, when they get older, they're more prone to this, but it can also be from eye diseases, um, or it could be just be a birth defect. If you smoke, I think it's if you smoke tobacco, or drink a lot of alcohol, or even just have a lot of exposure to ultraviolet light or lead, these can put you at risk for developing cataracts. But the treatment is really easy. You know, there's just a surgery that takes out your current lens and puts in an artificial one. So here I have a cataract surgery simulation. Okay, I have to put this up on YouTube because, so let me just share my computer sound.
Fundraising deadline coming up for Senate
But yeah,
Democrats,
I
and they
remember
need
watching a
your
cataract surgery when I was
to
younger,
meet
so I
it.
hope
Every dollar you
I don't
give
scar you
from now
guys
until
as
the
I was
official
once scarred,
FEC deadline
because this is
will
the
be
animation.
triple matched.
The lens of the eye is mainly composed of water and proteins. As we age, these proteins may begin to clump together and cloud the lens. This clouding is called a cataract. Cataract surgery is the removal of the affected lens from the eye and the insertion of an artificial lens. Before your surgery, you will be given eye drops to dilate your pupil, and the area around your eye will be washed and cleansed. In many cases, you will have a local anesthetic injected around or behind your eye. You may also be offered a sedative to help you relax. Most cataract surgeries last less than 1 hour. The most common method used for removing cataracts is phacoemulsification. In this procedure, the surgeon looks through an operating microscope and makes 3 small incisions, less than 1 inch long, in or near the cornea. An opening is made through the capsule of the lens, and an ultrasound probe is used to break the cloudy lens into tiny fragments. These fragments are vacuumed out through the incisions. Then, an artificial intraocular lens is inserted. Intraocular lenses, made of plastic, silicone, or acrylic compounds, have no moving parts and last for the remainder of a person's life. Because the incisions are so small, stitches are generally not necessary. Vision often improves, notably, immediately after surgery. Another method for removing cataracts is called the extracapsular technique. In this procedure, the incision made near the cornea is large enough to remove the cataract in one piece. Again, an artificial lens is inserted to replace the natural lens. Recovery from this type of cataract surgery is usually slower. Because the incision is larger, this procedure does require stitches. However, the stitches rarely need to be removed. After the operation, a patch will usually be placed over your eye, and you will be observed for a short time to be sure there are no problems, such as bleeding. Cataract surgery is performed on an outpatient basis, and most patients go home the same day. Since exposure to bright light may initially be uncomfortable, you should not plan on driving immediately following the procedure. You will need to make arrangements beforehand for someone to take you home.
Okay, so there's that. Right, so they kind of just, make a small incision, um, break the pieces of the lens apart, which sounds fairly weird to me. But then they kind of just like vacuum it out. I don't know. That makes it sound really bad. But it's a really effective method in treating this condition. And last we have color blindness. A lot of you guys may know someone who was colorblind. Um, so some of the symptoms is they have difficulty differentiating between certain color pairs, so like red and green. I don't remember the others. But there's those three main, there's 3 pairs of 2 colors that people have difficult distinguishing them. So images may appear as shades of gray to them, or also I see like maybe like pale yellow or like a really um, kind of like desaturated yellow. There also may be reduced vision and involuntary eye movement. So some of the causes are genetics. You know, a lot of people are just born colorblind. Also disease of the optic nerve or retina. And this is because, you know, in the retina, what we have there is called like rods and cones. So those are the like this, I guess you could say cells, like the photoreceptors that you know, help with your vision. And so one of them is for like color, and one of them is for the light. I don't remember which is which because it's been a while since I learned that. But that's the relationship between the retina, and then color blindness. And also just aging. Age, just growing older, is a big factor for many conditions and diseases. So the treatments or like the diagnosis is, you know, having that special color charts with numbers and seeing if you can see the numbers or not. You probably had that in like school. And so the inherited version cannot be cured. So you being born with color blindness are just being colorblind from birth. They can't fix at the moment. But if you have gotten it from like an eye disease, right? You can get your vision restored because, you know, once they kind of treat that eye disease, then whatever was working previously should go and work again, because it's kind of like undoing the step you just did. Okay, so now we have eye diseases. So someone said pink eye before, right? So conjunctivitis. So yeah, having like pink on your sclera, or having like crust on your eyelids, tearing, like just involuntary tearing a lot, and being sensitive to the light. So there's 3 types of conjunctivitis. So we have viral, bacterial, and then allergic. So viral and bacterial are both contagious, something you catch, I guess. But allergic is just because there's allergens that trigger it. So if you look at the picture here, they all look somewhat similar. It's just here, you know, bacterial has the crust. The difference between viral and allergic, I don't necessarily see the difference. Oh, allergic has a lot of tearing. So there's like little small things that kind of differentiate it for the 3 different types. But some treatment, you can use a warm or cold compresses, so kind of like an ice pack or like a heat pack. You could take medication, but it only works for bacterial. Or you could take antihistamine pills or eye drops, but that only works for allergic. And I believe viral, you cannot do much besides the warm or cold compresses. You just have to wait it out. So next we have glaucoma. So glaucoma is this condition where like basically you're going blind. This happens because, like it says right here, there's this fluid pressure inside our eye that damages the optic nerve, right? And once you damage the optic nerve, our brain cannot take whatever our eye is seeing and then change, like convert it, you know? So people become blind because they don't have the second step in creating those images from the brain. Some of the symptoms are tunnel vision, blurry vision, a lot of eye pain, nausea, light sensitivity, and tearing. And there's some treatments easier in the early stages, right? Having medicine, um, doing this kind of like laser surgery, or just going plain old surgery. Um, yeah, like laser eye surgery. Okay, because we're almost out of time yet. So our modern day connection is going to be the bionic eye. So I don't want to talk too much about it. But we've seen kind of um, in like orthopedics, in those things, people like amputees, they lose their arm, their hand, their leg. Um, but with them, we've gotten to that point where they have prosthetics. And there's some advanced prosthetics where we can connect the nerves um, so that, we can actually control it. It's not just something that's stiff and unable to really move on its own, right? So what they have here um, is it appears that they have like a bionic eye, and I believe it's still in like the early stages. But we're gonna see this kind of mini news article about what they have to say.
After a shooting accident.
Okay.
This man is Rob Spence and he makes films. No, literally, his body makes films. After a shooting accident when he was 9, Rob had to have his eye surgically removed. But after joking with friends about having a robotic cyborg one installed instead, documentary maker Rob actually went and did it.
Pretty much anyone who loses an eye will make a joke, at least. I should get a camera put in there. It's not a wacky, out-of-this-world concept.
Years of hard work and research have left him with this, a tiny camera implanted in his eye socket, which transmits video wirelessly to screens, TVs, hard drives and cameras. And it's opened up a whole new perspective for him, even getting him offers of, unsurprisingly, secret camera work.
One very high-up news executive said, would I like to go to Iraq with my prosthetic eye and see what I could see there? Because sometimes when you have a giant camera, it's not such a great idea in a war zone.
I recently traveled around.
But instead, sci-fi fan Rob went around the world making a documentary on cyborgs alongside the makers of the computer game Deus Ex. That game features a cyborg from the future. Here's one from today.
Okay, yeah. So basically, obviously, this bionic eye does not give them back their vision. But it does. Oh, let me exit full screen. Yeah, so it does not give them back complete, or even just restore their vision. But they still have minimal. At least they're not completely blind in that eye. That bionic eye. It's really expensive. First off, it's $150,000. So that's a really big price tag. But I feel like as our future progresses, things are always getting better. Things are always getting more effective. So maybe in the future we'll actually have a bionic eye that lets a person see 20/20 vision. Okay, so that's all I have. Thank you guys. If you have any questions for anything I said or anything you're still curious about, you can just drop it in the chat. Okay, but if you guys don't have any questions, you're free to go. We already passed the 40-minute mark.